Pharmacology is the core of drug development, a better understanding of the relationship between pharmacokinetic properties and the pharmacodynamic effects of a given compound to produce a key information for a successful preclinical development and clinical design. In preclinical pharmacology, we have the following points. We have a product profile. We have mechanism of action, animal model data, which include efficacy, pharmacokinetic data, and toxicity. Also, we have IND, package studies, and finally, we have pharmaceutics, dosage forms, and route of administration. So let us begin with the product profile. Claritin, which is loratadine, it is a white to off-white powder, not soluble in water, but very soluble in acetone, alcohol, and chloroform, and its molecular weight is 382.89 gram per mole. Mechanism of action. Loratadine is a tricyclic antihistamine which acts as a selective inverse agonist of a peripheral histamine H1 receptor, which is responsible for many features of allergic reactions. Also, it is acted by competitively block the effect of histamine at peripheral H1 receptor sites and has anticholinergic and antipyretic effects. In animal model data, in terms of efficacy, let's see what is efficacy. Is a study which form a fundamental and the main objective of preclinical pharmacology. So, sketching, the company that produced Claritin conducted an additional study of loratadine to address the issue of hypospadias after a cluster of cases was noted by Swedish Medical Birth Registry. The Swedish Medical Product Administration agreed with the sponsor's proposed protocol design for non-clinical studies in April 2002. So in this study, 100 mated female rats were exposed to 4, 12, and 24 milligram per kilogram body weight of loratadine from day 7 of gestation to day 4 of lactation. The androgen-sensitive period of genital development. Then the anogenital distance and the presence of nipples in both male and female were assessed, which are both the indicators of anti-androgenic activity in rats. Not only that, but also the presence of hypospadias age at the preputial separation, organs, weights of seminal vesicles, and prostate in males were evaluated, which are the additional indicators of sensitive to anti-androgenic effect. The report said that the maternal body weight gained and mean poop body weights were lowered at 24 milligram per kilogram dose, but no effect were noted at the other doses. Also, there was no effect on male genital tract in offspring at any dose according to the sponsor's report. In pharmacokinetic data, according to Dr. Sansilio of a pharmacology reviewer for this division, the data showed that no evidence of teratogenic effect in offspring of female rats given loratadine during gestation. Also, there was no evidence of anti-androgenic effect on offspring of female rats exposed to the loratadine during the androgen-sensitive period of genital development. In toxicity studies, loratadine was given to a rat orally at a dosage of 4 to 240 milligram per kilogram per day, and monkeys at a dosage of 0.4 milligram to 90 milligram per kilogram per day for 6 months. The results show that the anticholinergic effect reduced fecal excretion and mydriasis were observed in rats at a dosage of 128 milligram per kilogram per day and above. In monkeys that were given 16 milligram per kilogram per day for 12 months, study shows that the evidence of anticholinergic effect. Rats began to show evidence of phospholipidiasis, which is lipid accumulation in cells at the dosage of 8 milligram per kilogram per day and above, while in monkeys the same effect showed at the dosage of 4 milligram per kilogram per day and above. This phospholipidiasis has not been observed in men at these doses of loratadine. In central nervous system studies in the mouse indicates weak or no activity as an evidence of lack of central nervous system effect versus acetic acid rating and electroconvulsive shock seizure at dosage of high as 320 milligram per kilogram of loratadine. But also there was no evidence on teratogenicity in studies of loratadine performed in rats and rabbits at oral dose as high as 96 milligram per kilogram. But when given to the pregnant rat, loratadine crossed the placental barrier, and the concentration in fetus was lowered compared to the dam. And the dose of 64 milligram per kilogram per day caused a reversible decrease in male rat fertility. Lastly, in this preclinical pharmacology, we are going to see the dosage forms and the route of administrations. So, well, we have a Claritin tablet, which is 10 milligram macronized loratadine. It is given orally as a route of administration. Also, we have a Claritin syrup, 1 milligram per ml macronized loratadine, given orally as a route of administration. Also, we have a Claritin ready tablet, which is loratadine rapidly disintegrating tablet containing 10 milligram, also given orally as a route of administration. Now we have a Claritin D12 hours extended release tablet. Is a combination of loratadine 5 milligram coating for immediate release and 120 milligram pseudoephedrine sulfate, also given orally as a route of administration. And finally, we have a Claritin D 24 hours. This extended release tablet is a combination of 10 milligram loratadine coating for